I'm Jim Check. You're watching Now Media with me, Brennan Day. MLA for Courtney Comox. Also the health critic for the BC Conservatives on the NDP government, currently sitting here in British Columbia. And the sad thing is we do so many news stories. Obviously, we're out in the interior, and we see so many ER closures. It seems like we do one every couple of days, right? ER closure after ER closure. And then last year, they're mostly at the tail end of the year, but this year they started early, right? You know, little ones getting hit the most: Littlewood, Oliver, Merritt. And we even saw some stuff in the Lower Mainland this year, which is unusual, right? And we saw the big thing with KGH when they closed the pediatric ward, and then we saw some challenges again in Kamloops. It seems to be this problem is getting worse, not better.
Yeah, certainly we're seeing the effects here on Vancouver Island as well. I mean, Comox Valley Hospital, North Island, is seeing, not pediatric closure, but they're on diversion effectively because of a couple staff that are out. So I think everybody around the province is feeling it, certainly more acutely in the rural areas.
Is there, I guess, like some solutions in the horizon, or what do you see? Like, I mean, you get to see a lot of the data that the rest of us don't get to see. Are you seeing any chance that we're getting any recruitment? Or are we seeing any kind of like positive signs?
Well, I mean, the NDP are trying to recruit from the United States. I think that's going to be challenging given the wage disparities between the two countries and the poor exchange rate right now, frankly. People make decisions based on where they can go to make some money, not just the healthcare system. So, I mean, I wish them all the luck with that. But what we really need to focus on here in British Columbia is actually retaining the staff we do have. And I think the issue that's come up, and we've done a few FOIs recently, BC has the highest number of doctors per 100,000 people in the country, but we still have the second lowest attachment rate in the country. So the numbers don't track to me. So we have an efficiency and delivery issue here. And I think a lot of that's being eaten up by the health authorities in management versus, delivering those frontline services, keeping the ERs open, for instance.
Yeah, one of the promises by the NDP, David Eby made that promise that everybody would have a family doctor at the end of 2025, and that promise doesn't look like that's going to get fulfilled.
Well, we've been digging through the data from the primary care report, and unfortunately, it's what isn't shown in that report that's extremely concerning. They're saying that 24% of British Columbians currently don't have a family doctor in that report, or attachment to a nurse practitioner. That right now, given the population of British Columbia, means almost 1.4 million British Columbians are going without that primary service provider. And that's putting increased pressure on the ERs to deal with things that otherwise would be treated out of that setting.
I've heard like the reasons that they don't have, like why ER closures are happening from the NDP, but what do you see it as? Like, how does the Conservative Party see all these ER closures? What is the problem, the main problem, and what's the solution?
Well, certainly the staffing is the biggest solution in rural British Columbia. Right now, there's certain ERs in the interior for sure that they're offering $8,000 to $10,000 per 24-hour shift premiums just to get an ER doctor into the clinic to keep it open. So this is not just a BC problem. But what we have is a system now that really doesn't incentivize doctors to work in remote communities. And unless we start encouraging doctors, GPs and otherwise, to operate in those remote communities, we're not going to be able to attract ER doctors to keep those ERs open. It's very difficult to, sell Smithers versus the Lower Mainland, and doctors are graduating out of UBC, so it makes sense that they stay there. And we're also seeing a lot more doctors go directly into specialties now, whereas before it was fairly typical for them to spend quite a bit of time in general practice first.
So I guess my managing editor is putting some questions in here. He said, we've heard from people in smaller towns we see that feel like there's a two-tier healthcare system in the province, a kind of breach of that social contract. Is the answer to make doctors and healthcare staff agree to leave the Vancouver area and kind of like have to work in these smaller towns a bit too? Because like, how do we get people, it's tougher, like living in Vancouver is obviously a different lifestyle, but living in 100 Mile House and 150 Mile House and, like Merritt and Littlewood, these are isolated communities. How do you convince doctors and nurses to go to those areas other than money?
I mean, obviously money is one aspect of it. The other is making sure that doctors are trained broadly before they specialize to ensure that they're comfortable in those settings. A lot of doctors dislike small settings, because you have to be the jack of all trades effectively in some
Yeah.
of those remote communities. And if you haven't gotten that broad experience during your practicum, then it's challenging for them to get outside of that comfort zone to serve rural British Columbians. I mean, there's a lot of incentive to go to rural BC. I certainly couldn't live in a city myself, but that's, affordability comes into it, et cetera. There's a good lifestyle in rural BC, and for a doctor, good pay also. But that needs to be, they need to feel comfortable there.
We see these stories in the economy in general, and we see a lot of our youth leaving to go to Alberta for lower housing, better jobs, better pay, and all that stuff. That leaves a lot of like older people that require more healthcare. Do you think that's just like having an aging population without that youth in there too? Is that one of the concerns for the Conservatives?
It certainly increases the demand on healthcare in British Columbia. I mean, I'm on Vancouver Island, and certainly here, and I know in Kelowna, we have a extremely skewed demographic. When I graduated in 2002 from high school, most of my grad class left the province. Some of them have returned now, but we're kind of into that economic cycle where people are leaving to go and seek out opportunities elsewhere because it's impossible to get started here. So certainly the demands of the gray wave, I like to call it, are putting increased pressure on healthcare. But these were things that were anticipated 30, 40 years ago. This isn't a new problem, but successive governments have really kicked the can down the road in terms of the supports in place.
I know the NDP's got a few messes on their stoves: the economy, healthcare. We could go on and on, like capital fleeing the province. Where do you think healthcare fits? Like if Conservatives form government, where does healthcare fit in priorities for British Columbians?
Well, we need to start balancing both sides of the ledger. The NDP is really focused on government spending and public hiring. But unfortunately, without the capital on the other side paying the taxes to keep us all in these social services, what we're going to see over time is a degradation in those public services that we count on. Healthcare being by far and away the most expensive issue that we have to deal with. To try and address that issue, it needs to be a two-tier approach. We need to really take a hard look at the spending on healthcare, making sure that it's being delivered in ways that people can see and feel, which is, ERs, having a family doctor, and then making sure that on the other side, the economy is ticking along smoothly to ensure that we're keeping youth in the province to work and making sure that, the tax base is broad enough to support what is going to be growth in healthcare spending over the next several decades.
If the Conservatives were to form government, how do you go about tackling like this thing? Because I know it's a big concern for so many people, like healthcare, access to a family doctor, and then the accountability equation in there. We've seen, we've seen some stuff here in Kelowna too. That the CEO resigned finally after a lot of pressure because they said it was a toxic work environment. We've seen some of that stuff, accusations in Fraser Valley. Does the NDP hold people, the bureaucrats, accountable enough?
I personally don't think so. I mean, let's not paint all bureaucrats with a bad brush. They're the ones that keep things ticking along. But the growth, especially in healthcare, in what I would call nice to have programming, has become rampant. Island Health is an extremely good example of this. We have a couple FOIs right now just requesting all of the funded programs that are delivered by Island Health, because a lot of those are outside of the core scope of, what people would consider to be basic healthcare delivery in British Columbia.
So this is for some people that don't know what an FOI is, a Freedom of Information request, right? Mm-hmm. Isn't it odd that you have to make FOIs and say, why isn't that information just provided to the NDP? Like, why do you? Because I know when I ask some questions of Conservative MLAs, they're just like, can you ask for that for us? Because we can't get it. Why does the NDP not share information freely with you guys?
Well, it's not just us, it's with the public more broadly. I mean, the transparency of this government, it grades regularly against the national average as being bottom of the barrel. And unfortunately, it's really hard to address these issues if we don't know what the targets are and what the data is. And I think after 8 years, it's really hard for a government to increase that transparency because effectively they would be sharing their own record. So they're in the situation of, well, we even if they wanted to, they don't want to look bad. And we see that with the healthcare numbers, the 750,000 people being attached to a doctor since 2018 number. Well, that's new attachments. That's not people that fell off that list. That doesn't account for population growth. I mean, it's a bit of an optics play right now. And unfortunately, it's currently covering up their own poor performance. But I'm not sure how, as a province, we can measure success or failure, and turn the ship if we don't actually know what we're steering towards.
Yeah, we make FOI requests all the time too. When we say we send one in, and it takes like 10 days. We get a response. The response is, your request is too broad. You need to narrow your focus. And it's just a delay tactic. And then, lots of times you get something that it's all blacked out and you're just like, well, that's not helpful at all.
Yeah. And the cost attached to it, right? It really puts people off. And, I understand that there has to be there are privacy concerns, certainly when it comes to healthcare data, but the default position of government should be wide open, because then we can make those decisions based on the best, most current data we have. And if there are shortages in data, then we would know about it, and you don't have to go for a hunt through it. To try and tease out what the actual facts are. I mean, I find most of the time when I see these reports, I'm looking for what isn't in the report, not what is in the report, because the default is this opacity that seems to be a habit with this government.
We asked, they did a campaign in the UK. They did a bunch of billboard campaigns and that, and we got that because of one of our reporters is actually from the UK, so he saw the billboards up there in the UK, and they did a campaign there. But we can't get the numbers. Did we get any doctors from the UK? Did we convince anybody to come here? How much did we spend? And the question we had is, how much did we spend and what did we get for it? No answer. And then now we've asked, they paraded out there. They're spending, they did tell us that they're going to spend about $5 million in the US advertising. And they set up a coffee truck and stuff at, in Seattle and that. And but again, we don't have an update as to, I know they said they had a bunch of forms filled out, but how many doctors are we getting? And what is that costing it versus, the 7, I think it's 7, I could be wrong on that number, 7 or 10 pediatricians here in Kelowna that refuse to work in KGH. Getting them to go back to the hospital. Wouldn't that be easier fruit to pick than to go to the US and ask them to come here for less wages, higher taxation? And
yeah, I've got a pile of doctor emails on my desk from doctors and specialists from the United States, UK, South Africa, that are all waiting to get in. So there's a huge issue here. And a disconnect between the BC College of Physicians, which does the accreditation part of it, and the challenge exams. Right now, even if a doctor decided to come into BC, they wouldn't be able to challenge that exam until 2027. So they wouldn't be allowed to practice here for a year and a half. So there's a lot of bureaucratic hurdles that need to be addressed here, even for the doctors that they are currently now recruiting, let alone all of the doctors that are waiting in line to get in. So this is a huge issue. I'll give you one especially egregious example because it makes me chuckle every time. They were trying to get a locum doctor in here who's practiced in Canada in the past, has a great record, hardworking. He got stuck with immigration in Ottawa because the position was a 0.8 full-time equivalent. And typically when he'd been here before, he worked 1.2 full-time equivalent. So he actually worked too hard, and that's why they denied him. That process was brought to my attention in November. He still isn't able to practice here in BC. So we have a huge issue here. It's not for lack of doctors. It's a system that's really standing in its own way in terms of opening up the doors and encouraging people, making it a streamlined process and making it a welcoming place to practice medicine.
Why is that? Like, what do you think drives that? Is it just the bureaucrats? Is it just the policies that are there, or the College of Physicians and Surgeons? Like, what's standing in the way?
Well, certainly the bureaucrats want to protect their own, and BC College of Physicians wants to protect the integrity and quality of the doctors. So we can't just open the doors wide to everybody without some sort of scrutiny on people coming to practice in this country. But at the same time, the system is so complex, so slow, that we're effectively losing doctors just to the bureaucratic process. So we almost need an individual to walk these people through the process to ensure that we can get it done in a timely fashion. And unfortunately, right now, that's not happening.
One of the areas that were hit hard in these ER closures was Merritt, and we interviewed the Merritt mayor a couple of times, and he pointed to he lost 2 doctors due to the COVID mandate. And it's tough to convince doctors to go to Merritt in the first place, and then to lose 2 of them. Do you think that played a role in because BC was definitely hung on to those mandates for a lot longer than a lot of other places, that scared some of the healthcare professionals away?
But I think possibly a couple of years back that may have played a bit of a factor. I think now that's certainly less. There's no current requirements in BC that are not outside of the scope of the rest of the country. So definitely it turned a few people off. I think we've turned the corner on that. Obviously, any loss at this point when we're dealing with such an acute shortage is a major loss, especially in small communities. I mean, losing 2 or 3 nurses in a place like Vancouver makes no difference.
Right.
Losing 2 or 3 nurses in a small community is the difference between being able to staff the ER 24 hours or not.
Yeah, like it's just amazing that the frustration isn't higher when we see places like Lillooet in the wintertime. The ER closes and they're told that they have to drive to Kamloops. Well, like when you drive to Kamloops, that's over a mountain pass, right? And like that could be anywhere from like a couple hours to like 6 to 8 hours, depending on the roads in that, right? So, and also the difference between life and death in some cases, right? So I mean, British Columbians are being asked to do that so many times; it's almost like the norm.
Well, and as medicine has become more complicated and we've started to rely further on specialists, you're going to have to centralize those specialists at major urban centers and regional hospitals around to spread them out. You can't have every specialist at every small hospital. But the flip side of that is then we need to make sure we have an extremely robust transportation network to get people to that care. If you can't bring the care to them, you're going to need to get them to the care. And we've seen that we're desperately struggling here, whether it's ground or air, to ensure people are able to be transported regardless of the weather. Certainly in the interior, that's a bigger challenge. And so there's really large voids in this province where, yeah, certainly second tier healthcare, second class healthcare is the norm. And you're never going to get the same quality of care you'd get in downtown Vancouver, but the access to downtown Vancouver needs to be equitable across the province if that's the way we're going, and it certainly looks that way.
Anything you'd like to add? I do thank you for your time, though, making yourself available. That's great. Anything you'd like to share with us?
Yeah, I mean, I would just encourage everybody to be a little more critical when they're reading the reports from this government. Certainly, it's problematic to have to pick through the weeds and the details and the numbers. But at the end of the day, being transparent should be the priority of the government. And going forward, it's absolutely critical. We know the actual numbers and the actual facts, good or bad, so that we can empower healthcare professionals and the management to make proper decisions.
One of the topics that I hear over and over again, and we raise it many times ourselves, is accountability. If the Conservatives were to form government, would they be held accountable? Will they provide access to the media more so? Like, I mean, getting access to people like Adrian Dixon has proved almost like fruitless for almost any outlet, right? Like when he was health minister.
Well, I think it's really imperative that we have measurable metrics right inside the mandate letters to ministers going forward. There should be targets. And if the minister's not able to hit those targets, it should be public. They should be measured like anybody else. They're an employee of the government as well. And that should get passed down to the bureaucracy. If we're saying it's permitting in one ministry that's the problem, there should be permitting targets in that ministry. That is what that ministry is focused on. If we're talking about attachment ratios with Ministry of Health, there should be a rolling target every year that measures both the minister and the ministry so that they can make those changes early. That's the way private business works, and it introduces a level of competition and accountability that I just don't see existing currently.
The accountability to the media, because the media asks questions for the public, is severely lacking both in the NDP and the Liberals. They get very little, like, they go to the podium, they take a couple questions, they're allowed one question, no follow-ups sometimes. And, like, it's very hard to kind of pick at things if you're only allowed that one question, or lots of times they only allow select journalists to ask those questions, lots of times from friendly media. How would the Conservatives change that and allow themselves to be held more accountable?
Well, I mean, myself personally, I think the transparency and being able to have these long form discussions like you're providing here is critically important. Some of the issues, especially when it comes to healthcare and some of the bigger files, require a longer conversation to not only tease out the facts, but to shape the conversation, right? And we don't have that. We're media especially, and it's not, I'm not singling out media. We're so so stuck with these tiny soundbite clips and, 15 seconds.
That's one of the
Yeah.
things that we don't do. We definitely pride ourselves, and we're going to be the full interview. You can do what you need with it, and you don't get clipped. And you're not like, we're not going there, because I know that I've worked with some journalists that they're sent out for that clip. They want you to say those words, and they'll just kind of shape it and frame it as to finally get you to say those words. And that's all they want, and then just okay, we're done, right?
Yeah.
But I don't think you can get a real reflection unless you talk to somebody and let them have some time to answer those questions.
Absolutely. I mean, we need to start having more nuanced conversations around these things, because they're not 15-second clips. They're half-an-hour discussions that require all of the issues to be brought in and sort of investigated, because especially when it comes to healthcare, we see it every election. Well, we don't want to be the United States. Okay, no problem. Nobody, I think, is in the position of wanting American-style healthcare. But then we just avoid talking about all of the other nations in the world that have less expensive healthcare with better healthcare outcomes than us, that are using some type of mixed delivery to get there. And ultimately, we need to start taking the best of the globe and trying to apply it here in British Columbia.
And I think accountability and transparency is a good place to start, because it causes you to compete, causes you to be better, right? Because you have to answer the questions. If you don't want to take questions, it's pretty tough, right? If you're always just hiding stuff to whoever you want to change, right? And then people, want to try. There needs to be more accountability. And like I said, thank you for the time. Thank you for these long-form interviews for sure. And many of the Conservatives have put themselves forward. I do have tomorrow. I've been granted a 15-minute interview with Terry Young, the Minister for Community Safety, which is a big concern here in British Columbia as well. And
Absolutely.
we keep working at it. And we do thank you for spending some time here on Now Media with us.
Yeah, thank you very much, Jim.
And we do thank you for watching Now Media.
We don't just report the news. We live here too. We're your neighbors, bringing you stories that matter to all of us. No government funding, no outside influence. Kelowna Now, local, independent.